Thank you, Lenore, and good afternoon, everyone. Today is the first media briefing since the long weekend, so I would like to begin by thanking everyone in our city for doing their part to keep each other safe in our first weekend of Stage 3. I was pleased to see people moving around our city these past few days, out there on their bikes, walking around with smiles on their faces. I noticed others physically distanced on neighborhood patios. Many residents were also doing their part by wearing their masks as they went about their days. There is certainly more energy and more life in our city thanks to your efforts over these past months. Your actions will also help to keep us moving forward. The impact of your actions is reflected in today's numbers. Today, there are 18 new confirmed and 1 new probable case of COVID-19 in Toronto. To date, 14,015 people have recovered, an increase of 28 since yesterday. Our local numbers continue to be in the low double-digit range, which is good news. My team and I continue to watch our city's daily case counts. We also continue to observe what is happening in other parts of Canada and beyond to see what lessons we can apply locally to protect your health. In recent weeks, we have observed some concerning increases in COVID-19 activity in some jurisdictions that had previously reported low or no virus activity for some time. As I've shared before, we are expecting to see more COVID-19 activity in our city as we reopen. While our numbers are holding steady, this doesn't mean we won't see an uptick in COVID-19 in our city. These increases don't happen overnight. It can take up to 14 days to develop symptoms after being exposed to the virus, and then testing needs to be done before the positive results are then reported to public health and reflected in our numbers. This is why it is critical that we keep monitoring our numbers closely over the next few weeks to see how our reopening is impacting virus spread. I know these months have been very difficult since this unprecedented global emergency was first declared. However, this pandemic is not over. We will continue to live with COVID-19 for some time, and we need to keep doing our best to prevent this virus from spreading throughout our city. I've been receiving many questions about expanded gathering limits since we moved into Stage 3, so I wanted to take a moment to clarify this for you. While the province's gathering limits have increased to 50 people indoors and 100 people outdoors, our other critical public health measures have not changed. We must continue to maintain our social bubble of no more than 10 people with whom we may have close contact, keep 6 feet from people who are not in our social bubble, continue to use a mask in indoor public settings and when we cannot maintain physical distance outdoors, wash our hands often, and stay home if we are sick. At this time, we need to think differently about how to plan and organize social events. For example, please consider the amount of space available and limit the number of guests to make sure that everyone can maintain a physical distance of at least 6 feet from others that are outside of their household or social bubble. we also still need to keep washing our hands, watching our distance, and wearing our masks. These actions, along with our other public health measures, have helped us to safely reopen parts of our city so we can have safer social connections with our friends and our loved ones, which we all need for our well-being. They are also helping to restart critical local economic activity. Taken all together, they will keep us moving forward as safely as possible. Another way that we can all do our part is by downloading Canada's new COVID Alert app. This is a joint initiative of the governments of Ontario and Canada, and the app is now available for download at no cost from the Apple and Google Play app stores. The new COVID Alert app offers users the opportunity to quickly be informed if they may have been exposed to COVID-19 so that they can get tested right away to help protect themselves and those around them. This new app complements but does not replace our comprehensive contact tracing efforts by helping to quickly identify new contacts that may not have been easily found otherwise. It is built with a privacy-first approach and is a safe and easy tool that we can use to protect ourselves, our friends, our families, and our loved ones. I downloaded it over the long weekend, and I encourage you and all others to download it as well. Beginning today, new measures come into effect that require masks or face coverings to be worn in common areas in apartments and condominiums, and additional requirements as well for food and drink establishments. These temporary bylaws were approved by Council on July 29th to protect the health and safety of our city by reducing opportunity for COVID-19 spread. More information is available on these new bylaws on our website. Finally, I am pleased to announce that our provincial colleagues at Ontario Health are supporting another community pop-up COVID-19 testing site in Rexdale this Friday. The pop-up testing site is being hosted by a local partnership between the Rexdale Community Health Centre and the Health Commons Solution Lab. The testing site will be located at the Rexdale Community Hub at 21 Panorama Court and will be open from 11 in the morning to 7 in the evening. I would like to extend my thanks once again to our colleagues at Ontario Health and to the community leadership in Rexdale for this important initiative. As the warm summer weather continues in our city and more people interact with each other, we need to remember that COVID-19 is still in our community. We still need everyone to do their part to prevent further virus spread in our city. So please, continue to wash your hands, watch your distance from others, wear your mask, and as always, please continue to take care of each other. I'll now turn it back over to you, Lenore.
Thank you, Dr. de Villa. We'll now take questions. As a reminder, each media representative can ask one question and one follow-up. Before we get to your questions, we have staff on the line who can also answer your questions, including Barbara Gray, who is General Manager of the City's Transportation Services Division, Carlton Grant, Executive Director of the City's Municipal Licensing and Services Division, Howie Dayton, who is Director of Community Recreation, Gord Tanner, Director of the City's Shelter, Support and Housing Administrative Division, and Paul Raftis, who is General Manager of Senior Services and Long-Term Care. First up, we have Ashley Legasic, who's with News Talk 1010. Go ahead, Ashley.
there. Thank you for taking my question. So daycares have been open for over a month now, Dr. de Villa. Summer camps have been held for a month as well. Obviously, we're talking about different settings, but is there anything we've learned so far that can be applied to the reopening of schools? Have daycares and summer camps been a good kind of test run for back to school?
So thanks, Ashley. I think those are excellent questions, and I think each stage of reopening offers opportunities for us to learn from, and so that we can apply those learnings to our future activities. I will admit that some of the circumstances are different. For example, camps tend to be outdoors. School may have some opportunities to start off with some outdoor learning early on in the academic year, but of course, as the weather gets colder, that becomes more challenging. That being said, I think that we do learn quite a bit from each of these opportunities, whether it's how to manage kids, how to support them through appropriate public health measures and behaviors like hand washing or keeping distance. I think all of these are being taken into consideration, and they will be implemented and used as we go forward with the reopening of schools and with further reopening and further activities in our city.
Ashley, did you have a follow-up?
Yes, thank you so much. Now, the ministry told us today they will be lifting the daycare cohort limit of 15 in order to reach pre-COVID-19 capacity by the 1st of September. But they did say that public health would have to sign off on any center reopenings. So have you been in discussions about any updated guidelines for these increased cohort limits? And would you be willing to sign off on an increase to those sizes in daycares?
So Ashley, members of my team are actively engaged in discussions on all aspects of reopening, and that includes things related to childcare. I myself have not seen the specifics of the protocols for childcare. I'll look forward to hearing about them from members of our team. But please recognize that above all, we are absolutely trying to make sure that all the learnings, all the evidence that we know, all the practices from other jurisdictions and the experiences of other jurisdictions, as well as the experiences that we have had ourselves to date, are actually being incorporated into the next stages, whether it has to do with childcare, whether it has to do with schools. We are actively incorporating all the lessons learned in order to make the environments as safe as possible. But I think it's really important that we recognize that there is no such thing as a zero-risk environment. As we move forward, knowing that COVID-19 is in our community, we should expect that we will see cases, right? We will see increases in COVID-19 activity as more people mix with each other, as we see more interaction. The issue is making sure that we keep the activity, the COVID-19 activity, at a level that we're actually able to manage it as a public health system and as well as a health care system to ensure that we're able to provide the necessary health care to all those who need it, whether it's related to COVID-19 or to other health care conditions and medical conditions that will naturally arise within our community.
Next, we have Austin Delaney, who's with CTV. Go ahead, Austin.
Hello, my question is for Gord Tanner. Mr. Tanner, are you there?
Yes, I am.
Mr. Tanner, I'm just at the shelters in Midtown. I'm wondering your reaction, first of all, to the stabbing of a healthcare worker and the community concerns about the defecating, the theft, and the drug use by some people who are at these shelters.
So, listen, thanks for the question, and certainly, our thoughts are with the City of Toronto staff member who was stabbed last evening at the 5565 Broadway Avenue interim housing program. That staff person does remain in hospital, but is doing well, and certainly on behalf of the public service, we all send our best wishes to that individual and their family. We will be conducting a full review of the circumstances related to this incident in consultation with Toronto Police Services and our own corporate security division to determine some next steps, including what additional security enhancements may be required.
Austin, did you have a follow-up?
Yeah, as follow-up, just I didn't hear an answer to the first question. What about the people who are defecating, the thefts, et cetera, that's going on, the drug use that's happening there? And as the follow-up was going to be, why was there public consultation for the program?
I think you're cutting out a little bit, but I think the gist of your question is really, you know, with respect to the broader community around the Broadway apartments. Certainly, we are in touch with local residents, local councillors, and other stakeholders in the community. You know, since opening this interim housing program, we've brought 150 people who were otherwise sleeping in parks throughout the city with no access to basic sanitation and other you know, necessities of life, and we put them in interim housing to support them with the ultimate goal of getting them into permanent housing with supports. Since we've opened the program, we've enhanced our security and community safety measures at the shelter and continue to engage in dialogue with local stakeholders, including residents, business owners, and certainly with our colleagues at Toronto Police Services with respect to you know, how we can make sure that you know, our commitment to the safety of the broader community, our staff, and the residents of the program can be maintained.
Next, we have Faiza Amin with City News. Go ahead, Faiza.
Good afternoon. This question was for the mayor, but I'm not sure if staff on the line can also answer. We're hearing about tenants who lost their jobs, who are getting eviction notices as LTB begins to resume operations. So tenants are asking whether or not the city, and in particular the mayor, is planning to ban evictions in Toronto or intervene in any way.
Faiza, we could take that one offline and get back to you afterwards.
Thank you. My follow-up question is on behalf of my colleague Tina Yazdani. There are customer privacy concerns regarding restaurants collecting personal information. Why hasn't the city provided restaurants with any guidelines as to how restaurants should be collecting, keeping, and then disposing of the information?
Carlton, did you want to answer that question?
Yeah, I can. And this is something we actually spoke about yesterday. At the back of the city's bylaw, there is a form that provides basically a template for restaurateurs the ability to take the list of all that are attending. And then there, in our guidelines, there are rules that I believe could be corrected, that they are to be disposed of in 30 days.
Thank you. Our last question goes to Jennifer Pagliaro, who's with the Toronto Star.
Hi there. I just wanted to follow up on my friend Austin's questions to Gord. I'm wondering, Gord, if you can speak to whether those that were sent to the Broadway shelter are what you would describe as your typical shelter population, and if not, why those additional measures weren't put in place in the first place.
I mean, people who are experiencing homelessness in the city of Toronto are a very diverse group of people, and certainly we've seen through the COVID-19 pandemic that you know, a number of people have been moved from the base shelter system to achieve physical distancing across that sector. Individuals that were moved mostly into the Broadway apartments did come from encampments in city parks. And again, our goal was to get them into a clean, safe space where we can work with them, providing supports to get them into permanent housing. The supports on site are really tailored to the unique needs of the individuals that are using the Broadway apartments, and include a range of harm reduction supports, you know, access to primary care and other mental health supports through our counseling staff on site. And we continue to work with those folks. As mentioned, it's an interim or temporary housing program, and it will close at the end of August. It's our hope to get the majority of folks, if possible, into permanent housing by that time. And for those that we can't move into permanent housing by the end of August, we'll be moving into alternative accommodation elsewhere in the city.
Thank you, Gord.
Just following up on Austin's question about, sorry, Lenore, is it okay if I ask a quick follow-up?
Yeah, for sure.
Thank you. Following up on Austin's question about consultation, I know that the city's not required, city staff not required to, you know, get community sign off or consult community in the first place, but I know normally staff do try to communicate with local neighborhoods about incoming shelter sites, but I understand that may not have happened in this case. Can you just comment on that as well, Gord?
Yeah, certainly. So, it is our practice to undertake a comprehensive community engagement process well before the opening of a shelter service in any community in the city. In these situations and over the course of the pandemic, we were, forced with opening up to 30 new locations across the city. There was an exhaustive search for property, in every ward of the city, and time was of the essence. So that same kind of community engagement that's our standard, unfortunately, was not able to happen in these situations. We are committed to that ongoing engagement now, and a meeting has been booked broadly with community stakeholders, residents, businesses, in mid-August, and we look forward to continuing, to work with stakeholders in the community to make this program a success.
Thank you, Gord. That's it for today, everyone. Our next media briefing will be on Monday, August the 10th. Thank you, everyone.